So thoracic trauma. So abdominal trauma, we had a little bit, and then we'll move on to thoracic trauma. So thoracic trauma, E-fast. What is E-fast?
4+2.
4+2. Okay. And what is the most common cause of mortality in case of thoracic trauma? This is an MCQ, which was asked actually 2-3 years before. Which was the most common cause of mortality in thoracic trauma? The options are
tension pneumonia,
hypovolemic shock, tension pneumothorax, as you told, tension pneumothorax, tracheobronchial injury. Just out of these three, you tell me, what is the most common cause of mortality in a case of thoracic trauma? Remember, it is the tracheobronchial injury. Okay, most of the deaths are due to the tracheobronchial injuries only. Remember this MCQ. Okay, it is not due to hypovolemia or it is not due to tension pneumothorax in case of chest trauma. So tracheobronchial injury. Remember it. And flail chest. What is flail chest? Today morning we are discussing about this, right? Triage. When we are talking about triage, it is not under red.
Blunt injury. Blunt
So what is this
injury
flail
to the
chest?
chest.
Sorry?
Blunt injury to the chest.
Blunt injury to the chest. Yeah, there are rib fractures are there. So suppose these are the 3 ribs.
pulsating press.
Yeah. Multiple rib fractures, 3 consecutive ribs, and each should be fractured at 2 sides. 3 into 2. 3 ribs fractured at 2 sides. So this forms a segment of the liver. This forms a segment of the lung, which will not move with the normal segment because this is fractured. These ribs are fractured. So that segment is known as flail segment. Flail segment of chest. And we will have what is known as paradoxical respiration. Paradoxical respiration. That is, if the other segment moves away from in inspiration, this will be withdrawn because this has lost the support of the ribs. Okay, so this is known as paradoxical respiration. Yesterday we have seen one paradoxical thing. What is that?
Paradoxical acidosis.
Paradoxical acidosis or something else? Aciduria. It is
Aciduria,
paradoxical
sorry.
aciduria. Yeah. In which condition you have seen that? In which condition?
Obstruction.
Which obstruction?
Gastric.
Gastric aortic obstruction. Okay, good. So, and in flail chest, the cause of death is due to pulmonary contusion. The lung will be injured, so there will be a small bleeding. So, because of this bleeding, the patient may die. So, this is the most common cause of death is pulmonary contusion, nothing else. So, just you can answer. This is the flail chest. You can see 3 ribs are injured and at 2 sides. Okay, so that segment will go into paradoxical respiration. Paradoxical respiration is nothing but when the other segment moves away, this moves inward. When the other segment moves inward, this moves away. So this is just a paradoxical respiration. So can you tell me not a treatment option for the treatment of failed chest? Not a treatment option for failed chest.
Rib fixation.
Others? Any other answer?
Oxygenation.
Any other answer? IPPB. Okay. So everybody is sure with analysis. We have to give analysis, isn't it? Yes, correct. We have to give oxygen also because pulmonary complications are prone to happen. So we have to give oxygen. And there is no role of rib fixation. There is no need to fix the ribs. Just you give IPPV. IPPV is nothing but intermittent positive pressure ventilation. Just you put a tube inside, that is endotracheal tube, and you give positive pressure ventilation. You give high pressures of oxygen. Okay, just that will be enough to fix the ribs, but no need to open the chest and just to do a manual fixation of the ribs. Okay, so rib fixation is not necessary. It is not a treatment option in failed chest. Remember, this is also an important MCQ. Rib fixation is not necessary. Just give positive pressure, the problem will settle on its own, and the rib fractures will heal on its own. Okay, Yes,
Sir,
no?
how we have to give positive pressure?
Just by how we keep ventilation. Just put an endotracheal tube and give pressures. Connect him to ventilator intermittently. Okay?
Okay, then how that fracture will cure, sir?
See. Suppose this is the lung. This is the rib. So this is the lung, this is the rib. Because this rib has been damaged, the lung has collapsed. Okay. Suppose if you give positive pressure ventilation, the lung will expand and it will act as splint here. The lung will act as splint. Okay. So the fractured segment will remain there only. So after some time it will form callus and it will heal on itself. There is no need to repair the ribs. Okay.
Okay, sir.
But both sides of the rib are broken now, sir.
Yeah, both sides are injured, both sides are damaged, but just by giving the positive pressure, it will act as a splint.
Okay.
Even if you do a surgery, we have to splint it. Otherwise, there will not be stability. Okay, because the ribs, they won't move, right? These are not floating ribs. So they will be just at the position only, but just there is fracture at both the sides. So once you splint it with the lung itself, you're just giving positive ventilation, the lung will expand and it will act as a splint there. Okay.
Okay, sir.
And so what is this triangle?
Site for needle insertion in tension pneumothorax.
No.
Triangle.
Chest trauma. Angle of safety.
Yeah, it is the triangle of safety. Why is it known as triangle of safety? It is for insertion of chest drain. Chest drain. I think you have seen in pleural effusions, we will insert a chest drain. Okay, pleural effusion, pneumothorax, what do we call it as? In a pleural effusion, we just put a tube inside the pleural cavity. Okay, so ICD, yeah, intercostal drain. So that is the triangle of safety. Here below there will be the fifth rib, rib 5, anterior and posterior. There is pectoralis, there is latissimus. Pectoralis major and latissimus. In between there is a small space where we can just palpate the fifth rib and we'll put the tube there on the tip of the fifth rib. Okay, this tube will go into the pleural cavity. So this is the triangle of safety. Okay, to insert the chest tube, it is known as triangle of safety. And site for needle insertion is the second intercostal space, mid-clavicular line, second intercostal space. Okay, somebody was answering site for needle insertion of tension pneumothorax. It is second intercostal space, mid-clavicular line. Is it clear?
Okay, sir.
Yeah. And pneumothorax. What is pneumothorax?
Presence of air in the oxygen.
Presence of?
Air.
Yeah, presence of air in the pleural cavity. So there are two types, open pneumothorax and tension pneumothorax. Open is okay, it is not dangerous. It has an open wound. Okay. It has an open wound here. Okay, so it is not a so dangerous thing. But tension pneumothorax, the wound is closed. So it acts like a one-way valve. So the air will get trapped inside the pleural cavity. So what will this air do?
Push the chest.
Yeah, it will push the lung. It will collapse. The lung will collapse. Okay, the patient can't breathe if there is tension pneumothorax. So this is a medical emergency. So what you have to do is you have to put a needle here in the second intercostal space, mid-clavicular line, so that whatever air is there, it will escape. Okay. Yes, no?
Yes.
Pneumothorax is gas or air in the pleural cavity. There are two types. One with an open wound, open suckling wound we call it as, and one with a closed wound, that is which acts like a one-way valve. It allows air inside only, but it does not allow air outside. This is known as tension pneumothorax. It is a medical emergency because the lung will get collapsed if you don't let out the air outside. Okay. So see, there are two things in emergency, like one is tension pneumothorax and the other is cardiac tamponade. Okay, so both of them will get confused. Both have similar presentation. Okay, the patient will have sudden. The patient will not be able to breathe suddenly. Okay, he'll be brought to the emergency. The question will be of same wording, but what is cardiac tamponade is heart is enclosed in a sac called as
Pericardium.
Pericardium.
pericardium. So if there is fluid or if there is blood accumulating here, the heart will be compressed. This is known as cardiac tamponade, isn't it? Cardiac tamponade. We are mechanically blocking the function of the heart. That is cardiac tamponade. Okay. So how to differentiate between cardiac tamponade and tension pneumothorax? See, in the question, there will be these pointers. If there is hyper-resonant node on if you do just if you percuss, there will be hyper-resonant node because there is
air.
because there is air. Yes, and there is decreased breath sounds. If these two are there in the question, then mark tension pneumothorax. Tension pneumothorax. Okay. If there is muffled heart sounds, then you have to mark
Cardiac
Cardiac
tamponade.
tamponade.
cardiac tamponade. Okay. So both of them will have similar presentation up till now, but these features will differentiate. If the patient, if in the question, if it is given as muffled heart sounds, then you mark it as cardiac tamponade. If the patient has hyper resonant node and if the patient has decreased breath sounds, then mark it as tension pneumothorax. Okay. Yes. Yes. No.
Yes, sir.
Yes, sir.
Sorry.
Yes, sir. Yes.
Yeah. Management of pneumothorax. Second intercostal space. Mid-clavicular line. Insert a needle. Hemothorax. Hemothorax is, what is hemothorax?
Blood in
Blood
pleural
vessel.
cavity.
Yeah, if you put an ICD, if the patient is not able to breathe, you have put an ICD. If there is blood coming within, okay, if there is blood coming from the drain, there is a limit. Like if there is more than 1.5 liter, of blood coming through the ICD, then this is an indication for emergency thoracotomy. More than 1.5 liter or more than 200 ml for 3 consecutive hours. These 2 points, okay? More than 1.5 liter of frank blood or mixed blood coming to the ICD or more than 200 ml for the past 3 consecutive hours, it is an indication for emergency thoracotomy. But because something is bleeding inside, you have to open the thorax and you have to identify the bleeding vessel. Yes? No? Clear?
Yes, sir.
And
Yes, sir.
cardiac tamponade, there is a triad called as Beck's triad. What is Murphy's triad? Today we have seen what is Murphy's triad.
Appendicite.
Murphy.
Cholecystectomy.
Cholecystectomy.
Acute cholecystitis.
Cholecystitis. Yeah. What are the three?
Cholecystitis.
PVF in sarcoid.
Pain, fever, fever, jaundice.
Jaundice.
Then what is Charcot's triad?
PUF.
PJF.
The PGAF, sir.
PJF is
Charcot's triad is pain, jaundice, and fever.
Fever.
Okay.
That is PV, right? Pain,
Pain,
vomiting, and
fever.
fever.
That is
Pain,
PVF.
vomiting,
Pain,
and
vomiting,
fever
and fever.
is Murphy's.
So here another triad is Beck's triad. This is the third triad for today. Beck's triad. Beck's triad. There are
Muffled heart sound.
muffled heart sounds is there. Cardiac tamponade. You are pressing on the heart. Muffled heart sounds. One. There will be raised JVP. Raised JVP. Because you are pressing in the heart, there will be JVP will be raised, isn't it? And there will be decreased blood supply, hypotension. So no need to mark, just remember you are pressing on the heart, so muffled heart sounds, IVP, JVP is raised and hypotension is there. There is decreased blood supply through the chest. So there is hypotension. Yeah, 1 minute.
Just for clarification, Murphy's is PVF and Charcot's is PJF, right?
Yes.
Thank you.
Okay. So then